Over the past few weeks, you've been sending us in your questions from all across the country. They're really great questions, and most of them have been about the virus itself. COVID-19 is a new virus, one we've never seen before, so there's a lot we don't know. So we've brought in Dr. Isaac Bogoch. He is an expert in viruses. Dr. Bogoch, thanks for joining us and taking time to answer kids' questions tonight.
Oh, not a problem at all.
Okay, let's get right to our first question.
Hello, my name is Charlotte, and I am 7 years old, and I'm in grade 1. My question is, how did coronavirus start?
Terrific question, Charlotte. This virus actually probably started in a bat, and the coronavirus can live in bats, and it usually doesn't make the bat sick at all. And then it probably jumped from a bat into another animal. We're not what that other animal is. And then it jumped from that other animal into humans. But these viruses likely live in bats, and that's really where it started.
Charlotte, that was an awesome question. All right, Dr. Bogoch, this next question is so interesting. Have a listen.
Hi, my name is Addison, and I live on Maple, Ontario. Hi, my name is Avery. My question is, what does coronavirus look like in our bodies?
Oh, wow. Good question as well. What does it look like in our bodies? So I think it's a good thing if you sit down with an adult and you go on the internet, and I want you to look with an adult on the internet to look at what your lungs actually look like. And some people might say that's gross, but it really isn't gross. It's actually really interesting. It's a good idea for you to have a look at what your lungs look like. And then ask them to look for a picture of what the lungs look like when it gets an infection, like with the coronavirus or with another infection. You're going to see that the lungs look different. It looks like they're a bit swollen. They might be the colors might change, and they just don't look normal. And that's what happens when it gets infected with a coronavirus, is the normal lung doesn't look normal anymore. It looks sick, it looks unwell, and you can see this on the internet. If you're with an adult, you can look this up, and I think it's really important to see what it actually looks like.
All right, sort of cool, sort of gross. Those things sometimes go hand in hand. This next question is from Marcel.
My question is it true that everyone has to get the coronavirus in order for the world to be safe?
Marcel, that's a really good question. And, I really don't think that everyone needs to get the coronavirus for the world to be safe. I think that scientists are working on a vaccine, and hopefully this vaccine will be available really soon. And soon we'll have a vaccine for this that will protect us from this virus so that we don't all have to get sick from it.
All right, this next question we've had quite a bit because COVID-19 is a new virus.
Hi, I'm Marcel. I'm 16, and I would like to ask you, how do you get information about the coronavirus, and how accurate is that information?
Yeah, that's a really good question, because we know that on the internet there's a lot of information out there that might not be the most helpful, or it might not be the most accurate. I like to stick with a handful of very good resources. I think the World Health Organization has a wonderful website that's updated regularly that has excellent information on the coronavirus. And they even have a section on their website that talks about myths and rumors. And they talk about, what's true and what's not true about the coronavirus. So that's really one of my go-to websites. And then the Government of Canada has a wonderful website as well, with the Public Health Agency of Canada as well. These are updated regularly with fantastic information, the newest science, the newest evidence, the newest data, and it's a really good resource as well. So if you're going on the Government of Canada website or the WHO website, you're going to get the best quality information.
And we asked people like you, Dr. Bogoch. This next question is from Milton, Ontario. This one's in from Declan.
My question is, why can't we make the cure right now?
Yeah, wow. I mean, I wish we could. The cure for this is going to take a bit of time, and certainly there's scientists and doctors that are working really, really hard on this. And in fact, a lot of the work that's gone into this has really started about 4 months ago, and we're even starting to see some really good information come out now. So there certainly are some newer treatments that are available for this infection that can help people that are sick with the coronavirus. And I think in the coming weeks and months ahead, we're going to see more and more updates and newer treatments for this as well. So lots of work on this field. Stay tuned, because there's more good treatments coming ahead.
All right, I've got a really good one for you. Have a listen.
Why does it affect people in many different ways? Like, old people are dying and kids are fine.
Oh, Paisley, that's a good one as well. And as you point out, this virus really luckily in kids, most kids that get this infection do just fine. They don't really feel that sick and they get better really quickly. But we know that people's grandmas and grandpas can get really sick from this infection, and we have to do everything we can to protect the older people in our community. It's not entirely clear why this virus really makes older people sick, and that's certainly an active area that we're researching right now, because we know some viruses, other viruses can certainly make older people sick, but this one really seems to affect older people, and younger people seem to mostly do just fine with this. So I don't have a good answer for you just yet, but stay tuned. We should chat in about a month or two when we have better answers for that one.
Dr. Bogoch, we know that coronavirus is contagious, but here's a question to add to that a little bit.
Hi, my name is Maggie. I am 10 years old and I live in Toronto. My question is coronavirus more contagious than other viruses? And if it is, why is it more contagious? Or what makes it more contagious?
Maggie, that's a great question. And I think there's a couple of features related to the coronavirus that make it more contagious. First one is that some people who have the coronavirus don't actually have symptoms, or if they do have symptoms, their symptoms bad. They don't really feel that sick at all. So you can have this infection and not feel sick at all and start spreading this infection to other people. The second reason is some people who get infected with this virus who will have symptoms will have about 2 days before they feel sick. So for about 2 days before they start to feel sick, they can spread the virus to other people. And then 2 days later, they say, oh, you know what? I don't feel so good. And maybe I should go get checked out. But for the 2 days before they started feeling unwell, they were spreading the virus to other people. And these reasons are the reasons why this is spreading so quickly.
Dr. Bogoch, this next question is from a young man, Joshua, who wants to know about the work that you're doing.
About this pandemic situation going around the world, children and adults are going to have an effect on this COVID-19. And how are you all going to help children and adults get out of this situation? Thank you.
Fantastic question. So a lot of the doctors and scientists around the world are really doing their best, not just to treat people who are sick with this infection, but to look for ways to prevent people from getting this infection and to make sure that people who have this infection are given the best treatments possible so that they can get better as quickly as possible and get back to normal. So most of us are doing those three things. We're treating people, we're looking for ways to prevent you from getting it, and we're looking for ways that if people have this infection, we really want them to get better, so we're looking for different treatment options. That's really what we're doing.
You're also taking a lot of great time to answer all of our questions. So Dr. Bogoch, thank you so much. And on behalf of all of Canada, thank you for all the work you're doing in helping to keep us healthy and safe and in fighting the pandemic. Thanks so much.
Have a good one. Thank you very much for having me on.